Back with us here now on In Focus, Newsroom Africa, Channel 405. Thanks for staying on. The Western Cape Health Authorities are warning of a rapid rise in COVID-19 related hospital admissions. The provincial government says there are over 1,000 patients admitted to hospitals with the virus, which relates to a 47% increase since mid-May. For more on this, I'm joined now by the Western Cape Premier, Alan Winde. Premier, good evening, and thank you very much for your time tonight here on the In Focus. Let's talk a little bit about these numbers. If you look at what we are seeing now, it's as a result of actions that we took probably 2 weeks ago. If you remember clearly, we would have gone down to about a level 2 at that time from level 1. We have now just moved to level 3. Looking at what these numbers are telling us, do you believe we should have actually moved a little bit closer to level 3 even earlier on?
Not necessarily. I think for the Western Cape, we still seem to be okay. You know, obviously, looking at the numbers in Gauteng, I did send the Premier of Gauteng a message today. I know what it's like to be the epicenter. We've been there before. Luckily, we're not there right now, but I feel for what's happening in Gauteng. I think in our province, you know, we're sitting at now 1,174 beds filled in our hospitals. It's still a low percentage compared to our total beds. We've got 92% occupancy in our hospitals. So we still have some space. But over the next week, 2 weeks, of course, if the numbers continue at the same rate, it's going to put a lot of pressure on our system. We've got to then start decanting from our hospitals, maybe people who have got, elective surgery. They might be having a hip replacement or something like that. And those two start to clash. But right now, I mean, we've got more than 1,000 in hospital. Our reproductive rate has now moved up. We're sitting at 1.4. We're sitting at 16.2%, which is our test positivity rate. So all of those indicators are rising. So of course, we now need to make sure that we are flattening this curve as much as possible. But we still have all of our readiness. You know, we've only got our one hospital of hope, our field hospital, open at the moment. All of the others are closed, but we've got trigger points that they will open when necessary. Oxygen, we monitor it very closely. We've still kept the extra frontline staff in place. So, I mean, we're there, we're ready to deal with it, but you can see those numbers steadily rising every single day.
You're there, you're ready to deal with it right now, but what your head of health in the province is saying is that there is an acceleration, a rapid rise. It's not just a normal rise. I mean, if you look at the curve, even nationally, well, of course, particularly here in Gauteng, it's quite a sharp rise in that curve. Now, what we are seeing, particularly with this third wave, Premier, is that there is more mobility than it was in the second wave. But not only that, there is extreme lack of compliance at this particular point in time. At what point would you, as a province, consider the district approach, maybe even closing for 14 days just to curb the spread of the virus?
Correct. I mean, that's exactly what we called for, in December this last year, December and January, where we saw the rapid rising and saying we need some extra measures. I again say that I still believe that in South Africa we should have a differentiated approach. For example, the Eastern Cape and KZN, their numbers are way lower than other provinces. But I didn't lose. I lost that discussion on Tuesday at the PCC. So of course we get the same ruling across South Africa. But we will be monitoring our numbers, and if they get to a stage where we start to see those hospital beds really threatened, of course I will definitely approach the PCC and the National Command Council to say whether we need any extra measures in place. And we, again, this week held our weekly Digicon, where we bring all of our citizens up to date on as exactly where we are, down to our dashboards, and really calling for people to get that behavior change right. And I agree with you that many people are very complacent, not worried about the spread. But we saw it in the second wave, and I can already pick it up in the increase in numbers here, that now suddenly it's not over there, it's someone you know, it's much closer to home. And we did notice in the second wave that as soon as it came closer to home, people started to behave. I hope it's not too little too late. And that's really the question at the moment is we all need to take responsibility to making sure we're all playing our part in flattening the curve as much as possible.
Now, in terms of the models that you are looking at, what are they saying as far as mortality rate is concerned? We know it obviously kicks in a little bit later. It doesn't really follow the rate of infection.
Correct. So your mortality does follow on, that's the sort of second curve. You first get your infections, then you get your hospitalizations, and only then you get your mortality. But even our mortality at the moment, you can see those numbers going up. And when we add the mortality that we know that have been tested, plus the excess deaths that we're monitoring as well, you start to definitely see those numbers. And we try and correct it. So at the moment, you can see even sometimes up to 13 deaths a day in the province. So we might record 4 or 5 that could be COVID positive that we know of. Once you add the MRC data and the excess death data, and we add our own analysis, and we start to apportion those deaths, we start to see those numbers coming up again. And so definitely it is an indicator, along with the other indicators, that these numbers are climbing.
Reflect on the process of vaccine procurement, acquiring them, and putting jabs in hand right now in the Western Cape. What are the challenges? How is that process going?
Yeah, of course, that is, I think, my big challenge at the moment. We had, first of all, the promise of vaccine that we were supposed to get as a province. And then, of course, you also mentioned procurement. I'll deal with that now. But, we set ourselves on that trajectory, really pushing for registration, making sure we're aligning registration with our vaccine site rollout. So we've got a total of 70 sites in the city of Cape Town alone. We had 65 of those 70 sites already. We've got 204 sites in the rural areas of the province. We had 107 sites already in place, 33 of the private sector sites already in place. The problem now is the supply of vaccines is not keeping up with the opening up of those sites. So in some of those sites, we're having to send messages out to say, I'm sorry, we don't have sufficient vaccines for those specific sites. So, it might be half the number. And that is a bit of a problem at the moment that we're trying to deal with. We almost getting to, a daily vaccine rollout that keeps us almost exactly to those numbers. We're sitting with 15,000, just over 15,000 vaccines that we delivered today. That means that we can't go too much more than 15,000 tomorrow, and then our vaccines are running out for the week. We do have a promise of 140,000 vaccines next week. As long as those are in line, then our system will still keep going. But our opening of our vaccine sites is a very clear plan over the next while. We will be finishing for the first week in July the opening of our mega site, which is at the CTICC. We turned that into a hospital in the first wave. We're now turning it into a mass vaccination site now, especially when we move to the next cohort of 50 to 59. We've only got 720,000 citizens that fit in the 60 and above bracket, but we've got 1.6 million citizens who fit in the 50 to 59 bracket, so we need to really be able to up our numbers if we can align the vaccines. And then, of course, procurement, and that's our next problem. We have got a budget. We have got a procurement team in place. Obviously, when there are only two approved vaccines in the country, and we've already applied to both those companies, they're not wanting to supply a region as well as nationally. So
I wanted to ask you exactly that question, Premier. You were in the PCC with the president this week. Did you ask the president on why there seemingly is a prioritization of certain vaccines and not others, and there is not this inclusionary criteria when it comes to which vaccines we have in the country?
Okay, so no, I didn't ask him that question. I asked him whether he managed to get us a whole lot of extra vaccines post the G7 meeting. He was meeting with countries that have got lots of vaccines in their supply. What about us? Could we get some more? But when it comes to the actual procurement of the vaccines, we only have those two approved, and that they've got to be approved through SAHPRA. I have never wanted to bypass that approval process. I believe that we need to have properly approved vaccines. I understand there are 3 more vaccines in the pipeline for approval, so they're being tested at the moment. Our procurement teams will also be looking at those supplies. And I sent over the weekend, I sent a message to our procurement team to say, you need to up your messaging again. Those wholesalers, those countries that we've contacted that said, have you got any excess? Try them again. Keep pushing the button because, of course, with the Johnson & Johnson, those 2 million vaccines out of the system has definitely put us on the back foot. So we really need to try. Of course, and if I can get more, I want them for my province. That's my job. But if I can get any extra, I'll of course share them with other provinces too.
So if I heard you properly, Premier, you're saying there is a look at other vaccines. So is there a commitment from maybe SAHPRA, the regulatory body, at this particular point that they are considering other sources of vaccines for the country?
Correct. But remember, it's not up to them. It's up to the vaccine manufacturers to submit their own trials to SAHPRA, and then SAHPRA actually view it again, have a look at the data, have a look at the statistics, have a look at the trials that have been put in place for that specific vaccine, and through that process, they will give approval. And my understanding is that there are 3 other vaccines in the process right now. So that means that we can probably start looking at the procurement of those other vaccines. You know, South Africa is very far behind. If you look at some of the other African countries, I'm not even talking about, some of the bigger first world countries who really put money in last year. We are behind in Africa, and we need to do some big catch up. And of course, nothing makes it more urgent than a 3rd wave, and people are feeling it, and people are getting tense, and we really need to up our game here.
How successful have you been in the province with actually getting interest in people coming through and getting those jabs? In Gauteng, I tell you, they have now adopted the strategy to say walk-ins are now permitted at this particular point. We'll register you on site so as to just get a whole lot of more people in that 60 and above bracket, especially those with comorbidities, vaccinated at this point. How have you done it in the province?
So we followed the agreed rules to say, let's use the data system, let's use the SMS system. That we tried for a few days. We had some big hiccups with the system. Then we started the dual system as well quite a few weeks ago, where we said that you can do a walk-in as well as the appointment, because we also saw a number of people weren't making their appointment. I think the system was also sending people far and wide. So, you might have got an appointment being sent to you from your resident in the city, and suddenly you were sent out to a rural town, or vice versa. So I think that also caused a bit of a problem understanding those hiccups in the system. And so we have allowed for a few weeks the walk-ins, but it's about getting the balance right and the management right, because you also don't want to overcrowd your systems, don't want to overburden them, and you don't want your vaccine sites to become super spreader sites of the virus either. So it's about getting the balance right between the two. I think we are right with that, and we are right now with our bigger sites. We're going to have a drive-through site as well. That's on the Cape Flats. That's the 3rd mega site that's in the planning. We've got a private sector partnership site, and then the CTICC. Our big problem right now is the supply of vaccines. If we had more vaccines, we could definitely up those numbers, up the hours of vaccines, up the days. We don't vaccine 7 days a week in the public sector at the moment, because we're just still waiting for those extra supplies. That's the biggest blockage at the moment.
That was their Western Cape Premier Alan Winde on the approach that they are now taking as a province, particularly as they are seeing a rapid rise in numbers in hospital admissions, saying that 92% occupancy in their hospitals. There's still some room, however. They are, of course, concerned with the lack of compliance with protocols, as well as the higher mobility that we are seeing during this lockdown level 3. Let's continue for you here on In Focus, next in conversation with Nomboniso Gasa, following the ruling by the Pietermaritzburg High Court on the Ngonyama Trust, and she wants to highlight particularly how government has failed the people for the last 2 decades when these matters have been raised with them over and over again. We'll talk to her in a moment. Stay with us.